Thank you all so much for being here today. Welcome to the Senior Concerns webinar series. My name is Samantha Carnell, and I am the care manager here at Senior Concerns. And I am very excited to announce our speaker for today. But first, I have a few housekeeping items. So the seminar is being presented in hybrid form, and that means we have a few people here in person and some are watching online. So if you have a question, are you going to be taking those during or at the end?
I like during.
Okay, so Jordana is giving permission to ask questions during the presentation. So ask questions, and if it's something that's going to be addressed at a later time during the presentation, she will let you know. So I'm happy to introduce our topic for today, which is insights from the U.S. Pointer clinical trial protecting brain health through lifestyle interventions. Our speaker today is Jordana Lawrence, and she is the educator and care manager for the Alzheimer's Association. She has been with them as an employee for 8 years and oversees support groups and education in Ventura and Santa Barbara counties. Before that, she volunteered as a facilitator for almost 8 years, and she has been involved in some capacity with dementia for 30 years. So thank you so much for being here, Jordana, and I'm going to hand the floor over to you.
Thank you. Well, I'm so glad you guys were able to make it. This is kind of exciting, and frankly, this is new. This is the first time I'm doing this presentation because it is new. And it stemmed from the U.S. Pointer study, which we got the results from last year at the international conference that we did every summer, and they brought in the results. And the results were quite amazing because it had to do with lifestyle. It was a 2-year study about diet, exercise, and really challenging your brain. Right? And they had 2 different groups. One was a very controlled group under doctor's care, several meetings and really being tracked is to make sure that they were doing everything they were supposed to be doing. And then there was the second one, which was more motivated and didn't have as many doctor's appointments, overseeing, and stuff like that. And what they found is that it made a difference, that the exercise, the diet, challenging your brain actually made a difference. In fact, it can slow the progression of dementia by 40%. Wow. Yes, that's truly amazing. And for those that do not show signs of dementia, it can slow the starting of it also by 40%.
Wow.
So that is something that is very encouraging. And what was interesting, I found, even more than the fact of that, is that, of course, the percentage, what's the word I'm looking for there? The success of the more controlled one was great, right? But it was controlled. What I found interesting is that second group that was not as controlled still had a lot of success. And that even being self-motivated, because let's face it, how many of us can go years staying on the diet, doing the exercise, challenging our brains? We fall off the wagon, you know. We'll go and have that hamburger at McDonald's and we'll go do all of that. So it's a matter of seeing that on both of those case studies, there was success. So this presentation that I'm going to do came out of that study, and this is to kind of help people to get on track so that they can have the success as well. So let's get started. Okay, so by the end of the program, you're going to know what the difference is and how important it is. You're going to recognize the actions that you need to take and to help to make a plan on how to move forward. Because here's the thing, guys, it's never too late. Okay? It's never too late. And no matter when you start, start, whether it's very young, where you start having your kids and your grandkids start doing it, clear up to yourself, there's still gonna be success. I passed, Samantha actually passed all of this out. This is kind of like the start. This is for you to start looking at it after we're done here, to start looking at this and start saying, okay, how is it gonna work for me? What are my objectives gonna be to help to make it a success? This is what we're talking about, the 10 healthy habits for your brain, okay? This is what we know now is control your blood pressure, manage diabetes, healthy weight, smoke free, get moving, eat right, sleep, protect your head, stay in school, and challenge your brain. A lot of these are really kind of self-explanatory, right? We really basically know that, but we're beginning to fine-tune it more and understanding why these things are important. We've already talked about the US pointer and how important, and there's still more coming out about the pointer study because they're deciphering it and really going through it. But it showed that making these changes do make a difference. What is brain health? That's kind of easy, right? But here's the thing too. One of the things that I've noticed through my years of working at the association and talking to a lot of families is that there's very much a disconnect between the neck up and the neck down. How many times have you heard the doctor say, if you know somebody that has dementia, oh, your person with dementia is healthy, good blood pressure, heart's doing well, but they have dementia. And technically, dementia is a terminal illness. There is no cure. So what happens in the brain, it affects everything else that's happening in your body. So how does the brain work? You see the neurons that are essential to all human activity. And then all of these too. It's what makes the body works. It helps make it function. If your brain is healthy, everything else is gonna be okay. Well, for the most part, but you know. This is what I find interesting. So really understanding, because how many times have I had people say, how can someone die of Alzheimer's, right? But look at advanced Alzheimer's compared to the healthy brain. In fact, I've seen human brains that have Alzheimer's that have a hole this size in it. There's no way to repair that. So understanding that and thinking about how that's going to function the rest of your body can kind of help you to understand how important it is to have a healthy brain. And with Alzheimer's can start making inroads in the brain 20 years before the first symptom shows. That's amazing, right? I mean, when you think about it, because when we begin to see the symptoms, it's already been there for 20 years at least. So it's so important. That's why it's never too late to start. Understanding dementia. How many understand what the word dementia means?
Yeah, I had a lot of this stuff in school years ago.
Uh-huh.
I was a phys ed major, a health ed, health science minor.
Okay. So the word dementia is like the word cancer. So if the doctor says, well, yes, you have dementia, or yes, you have cancer, what would be the next question?
What kind?
What kind do I have? Alzheimer's is one form of dementia, just like vascular dementia, Lewy body dementia. So understanding that can help you when you're dealing with it. So cognitive decline just means that it's, your brain is declining. your daily life, right? And that's what's important. Mild cognitive impairment tends to be where a lot of people might get diagnosed. A doctor might be seeing your slight memory issues or whatever and might put you into this category. A lot of people are there. Now, mild cognitive impairment doesn't necessarily mean that it's going to advance into dementia, but almost everybody that's had dementia has had mild cognitive impairment. I know, go figure on that one, right? And then, of course, dementia. About 80% of dementia is Alzheimer's. It's one of the reasons why most of the studies are done on Alzheimer's, because more people have it. Vascular dementia, Lewy body dementia, and frontal temporal lobe are the ones that we tend to deal with the most within the association. But then there's the mixed, where there's other dementias that kind of, well, there's like maybe 100 to 200 different dementias. So, but these are really the ones that we tend to deal with. And we're also finding that people have mixed dementia. My mom was one of those. My mom had mixed dementia. She actually had 3. She had Alzheimer's, she had vascular, and she had frontal temporal lobe dementia. So it is important when you are, if you have somebody or yourself, to really press the doctor as to know what type of dementia you have. Because unfortunately, these dementias have different life expectancies.
How do they diagnose individuals?
So now, that's a good question. Someone asked about how do you get diagnosed? Well, now we actually have a blood test for Alzheimer's. So you can take a blood test and it can tell if it has any of the properties that would be in Alzheimer's. But it's in conjunction with a CT scan, an MRI, you do the memory test, you know, the clock, remember these 3 words, and stuff like that. So it's the combination of all of that. And
Can it sort through those options then by those tests?
yeah, absolutely. Because, for instance, like Alzheimer's will have the tau and the tangles, but that's not necessarily in vascular dementia. Frontal temporal lobe will have a little bit of that, but that's not the other 2. So there are different properties and there's different behaviors too. So as to the life expectancy, Alzheimer's is anywhere from 8 to 15 years. Vascular is the shortest, it's about 5 years. Lewy body is 6 years, and frontal temporal lobe is 6 to 8 years on average. My mom lasted 13 plus years, so she went a little further.
Can you repeat the percentage, how many years vascular is?
Vascular is 5 years. Lewy body is 6. Frontal temporal lobe is 6 to 8 years. Give or take. You know, because everybody's brain is unique, so their journey is going to be unique along those lines too. We now are beginning to see that the heart and the brain is very close, right? The heart pumps the blood to the brain. The brain, you know, the blood provides oxygen and nutrients. And what's the saying? What's good for your heart is also good for your brain. Another interesting thing that I just learned not too long ago is that 20% of what we eat goes to feed your brain. That's a lot. That's a high percentage. So whatever you're putting in is also going to help to keep your brain healthy.
Yeah, sure.
So, you know, go to McDonald's, that's not necessarily going to be great, but once in a while, sure it's the spot, right? Okay. When is the best time to start thinking about brain health? Well, as you can see, from day 1 and on your way. Well, especially if you're thinking about the fact that Alzheimer's is making inroads for 20 years prior to the first symptom. So, you know, I mean, and the thing is too that I think there's a lot of misnomers too, because I am seeing, like Samantha said, I've been with the Alzheimer's Association for over 8 years. Since I've been there, the amount of younger people that are having dementia. In fact, I read an article about a gentleman in England. He is the youngest man to die of dementia at the age of 27. So he was diagnosed at 24 with frontal temporal lobe dementia, and he passed away at 27.
That must have run in the family, a genetic thing.
Don't know. I mean, I have never heard of it that young.
No.
Certainly in the 40s, 50s. You know, my mom started showing signs in her late 50s, early 60s.
Will insurance cover a baseline test?
To be honest, I'm not 100% sure. I think Medicare is taking care of the blood test now, but they're kind of also fighting a little bit because they want the symptoms to be here, right? And the thing is that with the new drug, because now we have a new drug that can help slow the progression of Alzheimer's, but it's got to be in the early stages, and you have to be diagnosed with Alzheimer's because that medication is only for Alzheimer's. So it is imperative to get that, and the sooner you get it, the better off you're going to be. Because they are finding some success. There are side effects, so the doctor is going to have to test to see if you have a propensity for certain things. But once that's been cleared, then you're good to go. Okay. Health conditions. Okay. Maintaining a healthy weight, control your blood pressure, diabetes, and smoke free. All kind of like things that we know already. And it's just a matter of incorporating it even more into that. Actually, this kind of surprised me. This seemed a little high, 130 over 80. But that's what they should say, and then less for having a healthy blood pressure. And then, of course, managing your diabetes, maintaining, again, your healthy weight, and being smoke-free. Frankly, you should never start smoking because there's still damage being done from the smoking. That my mom had that, which we found out towards the end. Okay, brain healthy habits, moving, eating, and sleeping well. So getting moving. And moving really means moving. It's really having, and a lot of it is, it's testing your body, right? It's making sure that you're really moving every part of your body, and I think part of it is getting that blood flow going because it's going to your brain, and that helps to keep things going. Nutrition, the same thing. The MIND diet, which is what they used in the U.S. Pointer study, seemed to be quite successful, similar to the Mediterranean diet. And then sleep, deep sleep, is what they're talking about when it's washing your brain of all that's been in there. And that only happens when you're asleep at night. And that helps to keep your brain healthy. Challenges. Oh yeah. Getting on that exercise program, getting up every day, either to do it in the morning or after work or on the weekends. But the payoff is huge. So we're going to talk about that a little bit. So here's the suggestion of doing aerobic exercises because that's what gets your heart rate going and you're doing things. Strength training, making sure that you're strengthened, especially with women with osteoporosis and stuff, making sure that we're building healthy bones and stuff, that keeps it going. And then strengthening and stretching and balance, which is really important too. And stretching just helps to keep everything limber and helps you to keep you moving to be able to do the aerobic exercise.
This 15-20 minutes of strength training, that's not enough. You can't exercise all your major muscle groups in 20 minutes. No, you can't do it. I was a phys ed major.
Right.
You really can't. No, nobody's going to argue with me. You can't do it. You can't do it. It is not possible. Anybody that says they can't, they don't know what the hell they're talking about.
I think people have to do what they can with what limitations they might have.
Well, yeah, if you have limitations,
Right,
sure. But if you're a healthy person, there is no way in hell that you're gonna exercise all your major muscle groups and really load them up in 20 minutes. Can't be done.
all right, well, I think what they're talking about is that part of it, doing different things at different times, right? Maybe you do your upper body on one day, you do your lower body on another day, but you're also doing your aerobics, you're also doing your other exercises. It's not like you're just doing one thing. You have to do it all.
Well, you can do both in the same day. You know, you have to allocate your time.
Right, yeah. All right, so tips to get moving. And really, it's finding things that you enjoy, because then it's gonna make it easier for you to do the exercising, right? And doing something that you have never done before is really gonna help with challenging your brain. And we'll get to that point, because part of it is challenging your brain and really using your brain. All right, here's about the eating right. So I think pretty much you guys all know about this. This is not going to be new news to you. You've been following along, limiting red and processed meat, butter and margarine, cheese, fried foods, sweets. It's really kind of just starting to modify. If you're just starting to change, doing it slowly and then building up is going to make things a lot easier, and you're going to be able to progress. I don't think we need to really go through this, so we're just going to move on. Is there any questions? All right. So we know that there's been a lot of commercials about getting vitamins or supplements to help with the memory. Unfortunately, a lot of those have not really been vetted, and they're making claims that we don't have the evidence to back it up yet. So it's going with cautions, and also to really make sure if you are on medications, how it interacts with your medications and stuff. Sleep and quality sleep, we know now is so much more important. One of the things that I think has changed is to how much we need, which is 7 to 9 hours. Because don't you remember when we were growing up, they said, oh, as you get older, you need less sleep. Well, I always kind of laughed at that, because I always needed more sleep.
Yeah.
I mean, I always felt better when I had 7 or 8 hours of sleep, not 6 or 5 or 6. I always felt worse. So it's good to know that legitimately I can do that now. And I can say, oh no, I gotta go to bed. I have to have my 7 to 9 hours of sleep. So to be able to do that, we need, caffeine, we know, doing more physical activity. As you begin to start doing this new way of exercising for the US Pointer, you're gonna find that you probably will sleep better, because you're doing more physical activity during the day. And then you're gonna get a good sleep. And then keep a regular schedule of sleep, going to bed at the same time, and not having distractions is really important. And then, of course, all your other stuff, like your cell phones. Cell phones should be at least 8 feet away from your head, because it's still giving off radiation. So you don't want that so close to your head. You want it back a ways. And that'll help too with sleep. All right, let's talk about this, challenging your brain. That seems to be one of the hardest things, I think, for people to understand, of what it's like to really challenging your brain. what's great about it is like the cognitive reserve, and really beginning to make inroads in your brain. How many of you have heard that when someone has a stroke, that they have to remake new inroads and roads into the brain, that the brain is able to do that,
Yeah, I've heard that.
right? So it's kind of what we're talking about here too, is that we have to really push our brain so that we really make it, I mean, you have to really challenge it. If you've done crossword puzzles your whole life, that's not what they're talking about. Doing something, learning a different language, learning a new musical instrument. If you've never cooked, taking a cooking class, right? Those are very specific things. Or even starting, you know, for me, I finally got what they meant, because when I got this job, I didn't know, I had a background because I had my mom with dementia. I had been a facilitator for 8 years, but I wasn't doing it on a daily basis. And then this job came up and I applied for it. And I had come from a retail background. I was managing a shop in Montecito, and I was been doing that for quite a long time. Now suddenly I'm in a job where I have to do data entry every day. I'm doing consultations with families. I'm overseeing support groups and having to do all of that. I mean, there were times when my brain would feel like it would explode by the time I would get home at night. But I noticed after a year, I was remembering things that I had not been remembering before. I was more awake and being able to process the work that I needed to do. And it's like, oh, now I get it. It takes time to make those changes, but once you do it, you'll be surprised at how your brain can come alive on that. Okay. So, strategy games, doing puzzles, learn a language, explore a new hobby. How many of you have started a new hobby recently? Samantha, what's your new hobby?
Singing in a choir.
Wow. Oh,
So great.
there you go. Quite the challenge.
But yeah,
Yeah.
challenging.
Notes, hearing, focusing, those are all things that you use your brain for, right?
And it's social.
And it's social, which is huge too. But some of these, like with doing a new hobby or learning a language, you can do that in a classroom, and it's very, you know. So preventing injuries, especially concussions, so head injuries. If you've had a lot of head injuries, you're more susceptible to dementia. We think that that's one of the causes of my mother's dementia, because there was nothing in her family that would indicate that that would happen with my mom, but my mom had a lot of head injuries. And we think that that was partly what was so being very careful and cognizant of that. We also have an idea of hearing loss, vision loss can also make it a little bit more susceptible. Alcohol abuse, yes. That was also part of my mom. She had a drug dependency problem and never really got off the prescription drugs until the dementia got so bad she couldn't ask for her drugs anymore. So then she got clean and sober, but then dementia was already doing its thing. Air pollution, we now know, is playing a factor, and stress. The only thing I would ask about the short term is how many are short-term stressors?
Yeah.
Yeah, you know, let's be honest. Stress could be a long time. Okay. All ages. Absolutely, it's never too late. You know, including a variety of healthy habits, and consistency is the key. You know, it's just keeping at it. And the other thing that's going to happen, it's not just the long-term effects that you're going to see, which is going to help with the dementia or the delay of dementia or whatever. It's also how you're going to feel yourself. You know, it's fun to try something new, it being social, taking whatever. You're going to feel better because of that, and that's overall a good, healthy life. people, rewards that work, speak positively, and habit track. Meaning you keep track of what you're doing. That helps. The other thing I would put on there is not to be hard on yourself if you're not perfect with keeping on here, right? Because it's hard sometimes to just keep it going all the time. All right. It's time to build the action plan. So you all got your action plan. This is to help you to figure out how to do it and how to set the limits. Pick one of the areas you want to focus on, whether that's diet, exercise, whichever, starting with one and then building on that, and then you can move on to the next. Won't make it so overwhelming to have to do it all at once. So it's a matter of making the habit a permanent part of your daily life, week, right? So it's what is best for you. Everybody's going to be individual on that because we all have our likes and our dislikes and what we want to do and everything. Obstacles you might overcome. What do you think would be some of your obstacles?
I don't feel like it.
Yep. And what do you say to overcome that?
I'll do it tomorrow.
Uh-huh. But do you do it tomorrow? Exactly.
You gotta trick your brain and say, I will feel better after I do it.
Exactly.
That's
And
not
or you say, you know what? I don't care if you're tired, just do it. Go out the door. What I've started doing is I like to walk. So I will get home from work and I don't even change my clothes. I just drop my stuff off and I go out the door. Because if I spend too much time at home, and if I'm gonna change into sweats or whatever, it's like, oh my, forget it. I'll be too tired after sitting down, I wouldn't wanna get up. So I don't even give myself that choice, I just go out the door. And I do feel better afterwards.
And then the first step is always the hardest.
Oh, absolutely.
If you can get that first step, then you can follow through.
Well, and also I always use the thing too is, I used to walk a lot in my neighborhood. So I always saw people changing their paint, the paint on their house and all these different changes. And then I stopped, and then I started up again. And it's like, wow, they did this on their house and they did this on their house. So I get curious. It's like, okay, see what the change is now. And one of the things that I noticed with living in Ventura, people love to decorate for the holidays. And I, especially starting at Halloween and Christmas, are like the two biggest holidays around where I live. It's fun to just walk up and down the streets and see the decorations and everything. So that gets me, and then of course I go longer because then I'm seeing more houses and everything, and that helps to push, right? Because part of it is too, you gotta push yourself. You get into that, you go, okay, for this week I'll do 10 minutes a day. And then next week it has to get to 15, and next week it has to get to 20, and then you stop at a certain point, right? Okay. This is just to kind of help you to do it, and the biggest thing is overcoming. And we're our own worst enemies, right? Because we'll do some excuse and say, I don't feel like doing it, and we have to just bypass our own things that our brain is telling us. Because in the long run, what we're doing is to help our brains. Okay. I actually brought a handout of these, so I can give you guys these to help with just remembering what are the 10 healthy habits for your brain.
Leave it up. Just a
Okay.
second,
We
please.
want to,
Yeah, I have the thing here.
Get it?
Yes.
I was gonna say that when I go grocery shopping, I notice some people are getting, you know, public assistance for food. Okay, that's fine.
Thanks.
But I see a lot of these people, they buy chips and other junk food. We should all write our members of Congress and say, if you're getting food assistance, when you shove your, no, let me finish. When you shove your card into the machine, you are not going to be allowed to buy junk food. Well,
That's
you're
restrict-
talking about eating
This isn't the
food,
place.
you
Right.
know,
This
have a
isn't the place to
nutritious
talk about
diet.
that.
They shouldn't be able to buy junk food
No.
on their assistance card.
I understand that, but I think we need to focus on what we've got here. And this gentleman has a question.
No.
Oh, okay. All right, so we know what we need to do. Now it's part of it is implemented, right? So if, I guess we're at the end. Okay. So trying to keep this on track is hard, right? Because we do get tired, we may not be feeling well. But we know if we do these things, we can really make a difference with offsetting dementia. And that is the biggest thing, because we're dealing with a lot of it. Dementia is unfortunately not going away. Every year, the Alzheimer's Association does a facts and figures. And this year, one of the facts and figures that really kind of stood out to me is that between 2020 and 2024, heart disease, death by heart disease has actually declined by 3.8%. Death by Alzheimer's and dementia has gone up by 138%.
Jeez.
Wow.
Yeah, that, I don't know if I'm ever gonna forget that one, because that's quite the shock.
Is that dependent on the increase in older adult population therefore, because of that pyramid?
I think so. And I think the other thing too is that it's getting easier to be diagnosed. And I actually was in a webinar with two neurologists from San Francisco. A woman had her mother's neurologist there and another neurologist, and they were talking about that and said that now that the technology has gotten so good that they can really determine what type of dementia you have. And that is so important, right? Because some of them, as you know, have a very short life expectancy. So if you have a chance in being able to get an earlier diagnosis, how much more could you do to help to have a quality of life, right? With whatever time that you have left. So it's a matter of being able to get that information out there, to let family know what's available and what we can do to make a difference.
Do you have a flyer with the types that you're giving out?
I don't, but I can get it and then send it to Samantha, and then she can send it to you guys.
Oh, great, okay.
So, are there any questions from online? Okay. All right. So, the other thing, understanding and being more open, I think, to finding out what we're up against. Now, doctors are supposed to be doing memory tests on you at your physical starting at the age of 50. Well, my doctor did.
50 is a baseline.
Baseline, exactly. And my doctor did that, and I remember the first time it did it, I was not paying attention because it wasn't the clock, it wasn't the 3 words we had to memorize. He did it much more subtly, and it's like, wait a minute, what is he doing? And it's like, oh, he's testing my brain. And I see him writing it down, and doing his notes, and it's like, fine, my mom started showing signs in her late 50s, early 60s. So I was in my early 50s. Let them have a baseline, because if I was going to follow along, I would want to know, and do it, be a little bit more proactive. My family, my mother wasn't so much, but my brothers and my father, they were in denial about what was happening with my mom. Yeah, and it's important. It's really important for families truly to not be in denial. Why do you think I feel that way?
Because you can do something about it if you
There's
accept
that,
it.
exactly. But here's what's different with when you're dealing with someone who has dementia. As the dementia progresses, they are less able to participate in their care, right? So if we're in denial, we're not looking at what's really happening to them. So therefore, are we gonna get them the proper care? Are we gonna make sure that we're taking care of ourselves? Because now we're getting tired, right? We're taking care of them, we're not doing enough, and we need to bring in help. But if we're in denial, we're not gonna be able to do that. And families have a tendency of remembering their loved ones as how they were instead of how they are. And it's really important to remember how they are, because otherwise, how are you gonna get them the proper care? And if they have anxiety and they're anxious, we wanna help them with that, because people with dementia, they are anxious. My mom was, because of her mixed dementia, she was having hallucinations, she was paranoid, although to be honest, she was always paranoid. It just got worse as the years went on with the dementia. So it's a matter of understanding that those little idiosyncrasies when you're dealing with someone with dementia, and to be able to get them the proper help. And in Ventura County, there's so much out there to help everybody in the family. You just have to know about it. With the support groups that I oversee, I facilitate some of them, and one of the things that's been coming up lately is how they have felt isolated. That there is that isolation because you're so busy caring for someone with dementia that you don't realize what's out there to be able to help you. And that's what's important, because there is a lot out here to help. Senior Concerns is one of them. There's so much here that they offered to everybody to be able to help you navigate and get situated, but you gotta know about it, right?
Yeah, I'll add the Medicare, if you're part of the Medicare Guide program.
Right.
Starting in July, they just added another 4 hours of respite.
Oh, thank God.
So it's now 76 hours of respite caregiving, from July to June. And CMH has just expanded to cover, starting July 1st, they're covering Canal Valley
Oh, that's great.
and all of Ventura County.
Okay.
That's Medicare?
Yes. if
Well,
you
it's
have-
through Medicare, but CMH is one of the providers for Guide. The only thing is that I understand you have to have a physician that's connected to the hospital.
Right now, you have to have either a neurologist or a primary care provider that is CMH, or starting July 1st, UCLA Health, because
Okay.
it uses the Epic healthcare
Right.
system.
This makes me
So-
happy.
So it's here in Ventura County, and they are accepting enrollment to start July 1st.
Right,
What
and
is
there's
this CMH?
Community Memorial Hospital or Healthcare Group.
And that's
Well, that's down in Ventura, Community Memorial Hospital.
Yes, they have offices in Camarillo also, but they are the facilitator for Ventura County. But you could use your UCLA Health doctors and then be a part of the Guide program facilitation.
Well, I'm on Medicare, Medi-Cal.
That is a qualifier that works with the Guide program.
And there are more organizations, Bright Stars One, that also is under the Guide program, and they're down in this area as well. So there's a lot of different avenues to be able to use. It's just a matter of knowing about it, right? And being able to kind of get that help, because at some point you're gonna need it. This is not something that's an easy thing. Are there any questions?
Do you know if a blood test can detect Alzheimer's or dementia?
There is a blood test for Alzheimer's. That's why it's important to get diagnosed. You know, I mean, actually, if you need to find out, I had a friend who actually just emailed me, and she decided, I don't know why, to have the blood test, and it turned out positive. So she's now dealing with trying to get that done, but at least now she knows, and she can go and get the help that she needs.
I would also point out that the facts and figures study showed too that people can show the blood test can come back as positive, or a CT scan can come back positive as showing typical signs of Alzheimer's without the functional impairment. And so such a big part of what the doctors and the families have to report to the doctors so they can understand how functioning is impaired, because that really is the marker of whether Alzheimer's or any of the dementias is manifesting.
Because doctors can see certain things and say, oh, that's just anxiety, right? But there are certain markers, you know, in Alzheimer's, the repeating of the question, right? Forgetting appointments. You're finding the car keys in the refrigerator. You know, there's a lot of different things that can do it. Use your instinct. You know your loved one best. And if it, because the other thing is too, I mean, and I know a lot of people are afraid to get tested and to go and talk about it, but what if it's something simple? What if it's an interaction with medication? What if it's, you know, a vitamin B12 deficiency? I mean, there's problems along those lines, and then if you rectify that, then you're gonna be on the mend. So I think it's a matter of trying to just be honest if you're seeing things happening, because there are a lot of options. Plus, you know, it's a great time to get your medical power of attorney and all of that stuff in order too.
Push your loved one's doctors to do the test, because my husband was seeing a neuro. He had a stroke many years ago. He's blind in his left eye, so they started doing different types of testing. But the neuro never recommended blood work or a CT scan until I actually started seeing symptoms. So, talking about the medication, there's actually 2 medications. They're infusions. One you do every other week, and the other one you do once a month, but you have to do MRIs in between because they're watching how your body is reacting to the infusion. So don't wait for your neuro or your primary care doctor to say, oh, you have symptoms, let's do an MRI, ask for it.
We know, at least when, I don't even know what the statistic is, but back when I first started, the statistic were 40% of physicians were not telling their patients they had dementia. 40%.
That they had dementia?
If they had dementia.
Yeah, they weren't
So how, I mean, that's such a disservice, you know, I mean, and to not give people a chance to really be able to figure out what they need to do. You know, I mean, we were lucky in my family because throughout my life, my mom was very vocal about how she wanted things done. That if she ever got on a life support, if she ever, you know, anything ever happened, do not keep me on there, I want out. You know, and she made it very clear. And my parents didn't have a medical power of attorney. So when my mom's dementia got into advanced stages and she wasn't as verbal, you know, and then all of a sudden my mom had 4th-stage oral cancer. Highly aggressive, you know, she wasn't gonna survive that. So, you know, it's like, okay, what are we gonna do? And we decided to do 1 round of radiation because the tumor was on the inside of her mouth, and God love my mother, she still loved to eat. I don't care how deep that dementia got, Mom loved to eat, and that was the one thing that she had pleasure on. So we did the radiation treatments, and it was a nightmare. You know, I mean, somebody with dementia cannot be pinned down. You know, she didn't understand, she didn't remember why she was there. It wasn't a set schedule, it was more erratic, you know, and it didn't really shrink the tumor that much. You know, and the doctor wanted to do another round, and we said no. We were gonna make her comfortable. we were gonna give her pain meds, and we were gonna let nature take its course. And really, from diagnosis until when she died, it was less than 3 months. So it went really quick. I mean, I think my mom just said, I'm done. You know, let's open up the coffers, come in and get me, you know, and it was just because it was so fast. And she didn't seem to be in pain, you know, I mean, but hard to tell because she wasn't really verbal. Although when the doctor asked her if she understood what was happening, and she says, well, it's not good news. You know, and it wasn't good news, but I know when she said that she didn't understand what was being said. You know, and frankly, less than 10 minutes after, she asked one of my brothers why she was there and what she was doing there, which means she had already forgotten everything that was just said in the room. You know, so it does become up to us, and that's why it's important when we're trying to deal with it to not allow the denial to come in, because then we're not going to do what we need to do. And that's really taking care of our loved ones and taking care of ourselves, right? Because we count too. You know, I always use the adage for when I'm talking to families when they say, "Oh no, we gotta be there for our family." Well, if you've ever flown on an airplane and you have the flight attendant do the safety measures, when the oxygen masks drop down, who are you supposed to put on first?
Yours.
Exactly.
Your what?
Yourself, the oxygen mask, when it
Well,
comes
yeah,
down.
you put it on.
Right. But a lot of people, you'd be surprised how many people tell me you put it on your loved one first. You know, because that's the natural instinct of a caregiver, right? We take care of the other person, we're not taking care of ourselves. But we have to take care of ourselves too, because we need to take care of them. And sometimes that means taking a break, you know, having somebody come into the home or come to senior concerns, or however that looks for you as a family, that's what's important. But each family's unique. Okay, so any questions before we wrap this up?
Have they found out is there a genetic component to Alzheimer's?
There is a genetic component. I'm not sure what the percentage is for the genetic component, but I think it's relatively new territory. But so many families have it, so you know there has to be. Yeah. It's getting there. I mean, we have our international conference next month, so we're going to get some brand new information coming up. Can't wait.
That's exciting. We'll have to have you back to
I'll give you
give
what
us
the
an
new
update on
stuff.
what's
Absolutely. Can't wait.
Okay.
Thank you.
Well, thank you so much, Jordana, for being here today. And thank you all for your attention and your questions, and join us for the next one. Thank you.
What are your next